I am Ruby Boris. I'm the nurse practitioner at Seattle Reproductive Medicine in Tacoma, and we are joining together today to talk about PCOS and how it relates to nutrition. So this is the second in our PCOS series of webinars. Angela Thayer has joined us today, and she has some wonderful slides that we're going to present. Feel free to send your questions through the chat. Make sure it's addressed to everyone so that we can, both Angela and I can both see the questions. And we'll kind of address those as we go through, and then there'll be an extended period at the very end of our talk to address more questions that you have. And at this point, I'm going to turn it over to Angela to get started, and hope everybody has a good time.
Thanks, Ruby.
Yeah.
All right. So we're going to focus today on nutrition. And, the first thing we think about is, what's in your diet? What do you eat normally? And, are you eating healthfully? Are you eating good foods? And what we know from most studies of diets around the world is that a plant-forward whole foods diet is usually the best type of diet to treat a lot of things. It helps reduce insulin resistance, central obesity, and the risk of chronic disease. But unfortunately, the typical American diet has less whole foods and a higher portion of the ultra-processed foods and lower amounts of vegetables and fibers. So in the reproductive age women, most women do not get enough servings of vegetables in their daily diet to support fertility and reproduction. One of the reasons I think that we face that has changed over the past 30 years is these ultra processed foods that have actually been engineered to be highly addictive. This article, I think, came out in 2013, and you're welcome to look it up in the New York Times, but it really talks about the craziness of making these foods hyper palatable with combinations of salt, fat, and sugar to make your brain want more and more. And there was actually a quite elegant study that was published in Cell Metabolism. And in this study, they took 20 adults and they put them all in one area. And for 2 weeks, they were exposed to an ultra-processed diet and 2 weeks unprocessed. So 10 in each group, and then they switched over. So these diets were matched for calories, sugar, fat, and fiber and micronutrients. And what they found was when people were on the ultra-processed diet over 2 weeks, they ate on average 500 more calories per day. And at the end of the 2 weeks, they had gained about 2 pounds. And then when they went to the other diet, they actually lost 2 pounds. So just by being exposed to hyperpalatable foods and having however much they want, they just generally ate more calories. And when they ate the whole foods, they were satisfied with fewer calories. So just showing that processing really does mess with our brains a little bit as far as how much we're going to eat. As far as PCOS, it's tricky. It's not really clear that there is one best diet. So in 2018, there was a large conference that some of you may be aware of where international experts from all over the world came together to review guidelines and evidence and really publish what they saw as the best information available for PCOS. And one of the things they addressed was diet. And what they actually found was that there isn't one best diet. There aren't that many. Diet studies are notoriously very hard to conduct because there's a pretty high dropout rate. But they had looked at 4 studies, including a low protein, high protein DASH diet, which is the dietary approach to stop hypertension. And they really found that there wasn't really one predominant type of diet that helped women more than any other type. Some women who were overweight and lost a little bit of weight could regain some ovulation. So that was something they did mention. But general healthy eating principles are what was recommended. And so some of these things that kind of came out were, eat unprocessed foods, go for high fiber, go for your dark, lean, leafy vegetables and cruciferous vegetables, your berries, your plant-based proteins, olive oil, and dairy. So when we think about kind of mainstream, what diets are out there that people are looking at, and what we would consider that follow the best eating patterns, the ones we would recommend would be the vegetarian type diet, with a plant forward whole foods base, Mediterranean diet, which would also include things like fish and olive oil, nuts and seeds, the DASH diet, which is that diet that is lowering sodium for hypertension, and the low glycemic diet, which I'll talk a little more about, which is really talking about that glycemic index and some of the foods that maybe don't spike your glucose as high as quickly. So more complex carbs, less simple carbs. When we talk about intermittent fasting or time restricted eating, that's a popular way to eat right now. And I think that's okay if somebody is not trying to conceive. Frequently, if you can change the time of day you eat and you don't eat as late at night, that can be good. If your last meal, if your eating is basically within 8 hours, and you're fasting for anywhere from 14 to 18 hours, can work. This is a slide about just I pulled from the internet on the glycemic index, but you can kind of see if pure sugar is 100 and white bread is 100, you can look at some different foods here and see what they rate the glycemic index. And we generally would recommend trying to eat low on the glycemic index scale, because these would be more complex carbohydrates that would not tend to spike the blood glucose as much or have that insulin response afterwards. We also want to recognize that disordered eating is more common in women with PCOS, and this was mentioned in the international guidelines. So it is really important to focus on balance. And when we talk about this, we don't want people to do any restrictive dieting that is going to be too calorically restrictive. A lot of women don't eat enough calories, and then that can slow down their metabolism and have the opposite effect. So we really, when we counsel women on healthy eating, we talk about mindfulness and intuitive eating, and focus on balance and focus on what foods you like to eat. And there are no foods that are really off limits at all. So those are all important things to think about. When we talk about unprocessed or minimally processed foods, these are foods, you recognize as being whole. So all the fruits and vegetables, salmon, eggs, which are, particularly good if you're trying to get pregnant for the choline concentration, fruits, beans and lentils, and whole grains. So the plant-based proteins such as lentils and beans, these can be a great source of protein in your diet, and they are inexpensive, and if you know how to cook them, they are delicious. So I actually much prefer cooking my own beans from dry and soaking them. And they'll taste so much better than in a can. The canned beans or boxed beans, if we don't want the BPA exposure, certainly those are nice shortcuts when you're really short on time. But if you have the time, soaking some beans overnight and then cooking them is going to give a much richer flavor. And then you can use these really for any meal, soup, salads, or main course. Long term, when we talk about diets that we don't really recommend, that would include things like the keto diet and the low fat diet. And the reason these diets have not been recommended long term is that they are more restrictive and very hard to stick to. So although keto diets may be good for weight loss because they do restrict and cut out whole groups of foods, most people do not stick with them long term for years and years and years. It's really hard to get rid of most carbohydrates. And carbohydrates obviously have a lot of nutrients. And by the same token, the low fat diet, which was, the diet of choice probably for a long time in the 80s, really ended up leading to more carbohydrate consumption, especially those carbohydrates that are processed, like bread and pasta and grains, which are higher on the glycemic index, and so certainly not ideal.
So we actually had a question that's very similar along that same line.
Sure.
Since there isn't the perfect PCOS diet plan for those women really needing to rewire their nutrition, which of those four diets we were talking about recommending, which would you recommend to start for someone to start so they don't feel overwhelmed?
Well, what I do is really start with taking a survey. So that first slide of what do you eat? How do you like to eat? What's your style of eating? Because you don't want to take a major leap one direction or another. When you're making changes in your diet, we really emphasize taking baby steps, doing incorporation of better foods. And as you start incorporating some of these better foods, which is in general plant-based foods, so more vegetables to get those vegetable content up, usually, 3 servings of vegetables a day, 2 servings of fruits a day, things like that that you're aiming for at a minimum, or 25 grams of fiber for people who like to look at fiber content. Um, and so I hesitate to say there's one thing I would go to because it would be individualized. It really is where do you like to eat? What are some of the easiest changes we could make to make your diet a little healthier?
Yeah, and along that same line, I like to help people by taking what they are already eating when I'm counseling my patients and say, okay, let's take some examples for what you're already eating day to day and see how we can improve upon that. So an example would be like if you eat oatmeal first thing in the morning, that's like your breakfast. You can use those like little oatmeal packets that are really high in sugar and high glycemic index, and we can change that and maybe use some like steel cut oats with some flaxseed and lots of berries, and then you get lots of fiber, and it's plant centered and it's whole foods, and it sustains your it takes care of that hunger as well. So it's just looking at kind of what you're already eating and how you can improve upon that. And so it's more like what you're eating day to day, and there's not any huge changes.
There's not any huge changes. I mean, there are some tricks, for instance, for people who want to eat more in the vegetarian style, but yet enjoy animal products, or they have a partner that really eats a lot of meat or enjoys meat. It's really hard to just change that completely. So, we don't talk about that. We just talk about maybe decreasing portion size on that. So if you have, 4 ounces of meat, maybe you go to 3 ounces or 2 ounces, or maybe, that's one day a week you don't have meat as your main. You try and do a plant-based protein as your main protein source at a meal. And then you gradually just work from there. So you don't, I don't recommend really huge dramatic changes because that's harder to stick with. But if you just make small changes and gradually let your palate adapt and learn some new cooking techniques. Sometimes people don't really know how to cook vegetables to make them palatable, or some of the lentils or beans. And so it's an educational process as well with expanding your home cooking repertoire that really will lead to fun in the kitchen and great success. And we all love food, most of us do. So we want to be enjoying what we're eating and make it really, really great.
I feel like I've had really good success too for people that are just kind of getting new. If they're not really familiar in the kitchen, sometimes it's a little bit intimidating if you haven't been really into cooking before, but it becomes very fun once you feel invested in it. And there's actually two, in some cases, it can be helpful to have like a meal planning service. So there's two that I like. There's one called Meal Mentor, and I believe the website is getmealplans.com. And then there's the Forks Over Knives plant-based meal planning service, and they send you recipes as well as your shopping list. So it takes some of that question out of things initially when you're just getting started. It can help if you're not really as familiar with cooking with these things until you get your feet wet. You kind of know what things that you like. But both of those are great, and they're both very plant forward.
Yeah, great. And then, one thing also I talk to a lot of patients about is a pro-fertility diet. So people don't realize that actually their diets have been studied with regard to fertility and which types of eating patterns promote the highest odds of a live birth. So there have been a number of studies over the years looking at what eating patterns seem to be the most fertile. So the most recent recommendations, if you are trying to get pregnant, would include trying to buy low pesticide fruits and vegetables. So this would mainly be if you have access to a farmer's market. This is a great place where really they're trying to use less pesticides, more natural forms, and also organic, which requires additional certification if you're shopping in a regular grocery store. Um, Even organic does have some pesticide residue. So, we do always recommend continuing to rinse off fruits and vegetables when you have them at home before consuming them to also limit the incidence of disease transmission. And then whole grains. And you can look at like Old Ways whole grains for ideas about recipes and things like this that aren't as processed. Seafood, things like your fatty fish for your omega-3s promote fertility in both men and women. And when we talk about dairy, dairy is pretty neutral, but in general, one serving of whole fat dairy a day for women who consume that had better fertility and better ovulatory patterns than those who did not. So for women with PCOS who aren't ovulating and maybe having a low fat dairy product, I do recommend switching to a full fat dairy, especially like Greek yogurt or something like that can be a great option. Soy also has been, there's been concerns about does that hinder fertility or help fertility? And actually, it helps fertility. So, in all the studies, people who consumed soy, which is tofu, tempeh, edamame, have higher fertility rates. So, you don't need to be afraid of soy at all. And then as far as supplements, we certainly talk about prenatal vitamins, which have the extra folic acid, a vitamin B12 supplement, and vitamin D as enhancing and increasing fertility for those on who are trying to conceive and want to eat a pro-fertility diet. As far as what can be harmful, actually people who consume red meat, so that would be beef, lamb, or pork, that had a lower rate of fertility. So again, if you were trying to reduce or minimize some of the things that were more inflammatory or harmful toward fertility, we would reduce some of the consumption of those products. And poultry is neutral. So poultry was the neutral animal product, seafood beneficial, and the others not so helpful. And so then just my last summary slide before we get to more questions is what is the best diet? And again, just to, for those of you who jumped on, there isn't one best diet, but it is a plant-forward, whole foods diet that is tailored for you. It's tailored for your eating preferences, something that appeals to you, that is delicious, that you can share with family and friends and enjoy the joy of cooking and savoring your food and eating mindfully and trying to get away from some of the marketed processed food that is just so prevalent in our society these days. So that is it for the formal presentation, but hopefully there's some other questions.
Yeah, we definitely have some good questions. And I heard something once, and I can't remember where I heard it, but it was a speaker that said, eat plants, but don't eat things that were made in a plant, like a factory. And that really just stuck with me. It's just something super easy to remember. So the first question I have here, which goes towards the glycemic index, and I love this question. Are there any concerns with about beans and lentils about the higher carb/glycemic index?
Yeah, I mean, this is why I think it's important to individualize. I've certainly taken care of so many people over the years, and some of them do have more sensitivity to some of those higher glycemic plant-based proteins like beans, and so they don't want to eat as many. And other people, those seem to be absolutely fine. So I think you need to really check it out yourself and see how your body responds to it and see if first it stabilizes your weight and you're doing okay and feeling good with that, then that's something for you. And if it's giving you too many highs and lows of blood sugar and you're gaining weight on that, then that may be something you don't want to have as much of.
Yeah, and there might be something with balance too. So I get this question about fruit a lot too, because a lot of fruits tend to be higher in glycemic index, but it's all about balancing because certainly fruits have a lot of antioxidants and other nutrients that are helpful. But if we are getting a combination of, protein as well as the fruits, there's not that spike in blood sugar like you would see if you're eating something that's more processed, that doesn't have that balance to it.
Right. And with fruits, most people aren't going to eat, three apples or three
Right.
bananas. You're going to eat one and be pretty satisfied. And so, when you're eating that apple, you're also getting the fiber.
Mhm.
Um, fruit juices and smoothies actually aren't so good because you can actually get quite a lot of sugar that's already been partially, um, you know, digested in a sense. It's been blended. Um, and so, sometimes that's another thing people have to watch is if they do enjoy some of those breakfast smoothies to make sure that they also have other protein in there as well. And some people need to limit that too.
Yeah, as close to nature as possible. If you're looking at making a choice between like apple and apple juice, you're going to want the apple because it has all that fiber in it. And really, I've found that if you are focusing on the fiber, if that's something that's easy for you to look at, it's actually really challenging to get to that recommended. And really, that 25 grams is kind of the minimum. And I want to say it's like 90% or more, or probably even higher than that, of Americans don't get enough fiber. Like it's really hard to get the amount of fiber that we're supposed to have. But if you're eating mostly plants, you're going to have a higher chance of meeting that fiber goal.
That's right. And I think fiber is a great thing if somebody does want to try and have some. So a lot of people like to measure, have something measurable, but looking at and getting familiar with fiber contents of food can be really helpful. Yeah, and ideally, if I try and get somebody to aim for 25 first, and then maybe even go closer to 40 if they can. Hmm.
All right. So for individuals with PCOS who are also breastfeeding, is there one diet or area of food that helps balance supply for mom's health and for breastfeeding supply?
Gosh, that's a great question, probably for somebody who might know a little bit more than I do. I know in general, breastfeeding, when you're lactating, you do need about 500 extra calories per day if you're trying to maintain your body weight. That it actually takes quite a lot of energy, additional energy needs. So you just really want that energy to be coming, I would just say, from the same great food sources. I don't think you need to do anything special, I would generally say, but I think you could, speak to a dietitian or a lactation consultant about that.
Yeah, I would. I've heard good things about oats, like oatmeal can be helpful for supply, but also something like intermittent fasting. I would imagine that would not be recommended because you want to make sure that you maintain that kind of more residual um, overall balanced approach. But
Right.
yeah, lactation consultant or dietitian would really be helpful for that, I think. And would you recommend or suggest folic acid or folate?
So yeah, you're actually getting both. So you're getting folic acid when when you're taking your vitamins. And so what's recommended is 400 micrograms of folic acid in your prenatal. You're getting folate or dietary folate equivalents when you eat foods. And so you can kind of get sophisticated and look all this up. Certain foods are going to have more folate than others. It's actually pretty hard to get the full amount of folate from your diet alone. Um, Other things do have folate added, folic acid or folate added, such as grains that are enriched, can have, folic acid added. But that's why anybody who's trying to get pregnant, where we want you to have adequate amounts of folic acid in your system to prevent or reduce the risk of neural tube defects, we do talk about making sure you're taking a supplement, ideally for 3 months prior to conception.
Yeah, definitely. And then thank you for bringing up soy. I've heard to avoid it from family and friends, non-medical professionals. Yeah, it's one of those things that are out there that there's some rumors about it, but it's actually very beneficial for overall health and definitely for those trying to conceive. Okay. Would these diet tips be helpful for those of us who are not wanting to get pregnant? Absolutely. This is a
Absolutely.
lifetime beneficial diet. There's been shown to be less risk of diabetes, hypertension, metabolic syndrome with a plant forward diet, whole food plant forward diet. So absolutely, it's great for PCOS, even for those not trying to conceive.
I completely agree. I talk about these types of eating styles as really longevity promoting. So if you think about the blue zones and the way they eat, it reduces the risk of certain cancers and other inflammatory conditions long term, reduced risk of cardiovascular disease. So again, these are great general diets, but then you have to kind of find your own little niche in there of what's going to be best for you. But the general styles of going to a plant-based diet as the bulk of your food. Usually I talk about it taking up about half of your plate for breakfast, lunch, and dinner. If half of your intake is coming from fruits and vegetables, you're doing well. You might be hitting that recommended serving amount per day at that point.
Absolutely. Let's see. Do you have any favorite resources for recipes, cooking instruction that support these whole food, plant-forward menus?
There are so many resources out there, Ruby. You might have some good resources.
Yeah.
What do you like?
Well, like I mentioned before, Forks Over Knives is they have a wonderful website that has free plant forward recipes. Their app is fantastic. They have really good recipes there. And then the Meal Mentor, I dropped that in the chat, the website. She has wonderful cookbooks. She specifically focuses on whole food plant-based diet that's also low in oil. So it's great for people that have some metabolic syndrome or cardiovascular disease if you need to decrease your saturated fat even lower. And her recipes are very, very quick and easy. And then I'm trying to think. Yeah, there's some really good apps.
There's a lot. I mean, the one thing there's I like that I mentioned is called Old Ways, Whole Grains, and they have a lot of resources and like learning about kind of ancient grains that you might not be as familiar with and how you can cook with those. And I do recommend, not going to the fanciest chef-based cookbook that has a whole lot of rare ingredients. We tend to try and keep it simple. So something that's, 5 ingredients. I mean, I roast vegetables every week, and that is really just taking whatever vegetables I have in the drawer and cutting them up and tossing them with some olive oil and salt and putting them in the oven for 30 minutes at 375. So that's like a staple for me, just because they're delicious and they caramelize some of the vegetables. And so it doesn't take much. I make hummus every week by soaking chickpeas and blending that with tahini and garlic and some olive oil, and that's a great thing to have on hand for protein. So you go to certain things, and you get used to making some staples, and then you can expand from there.
Yeah, whatever is easy, whatever you have on hand. I also, let's see, oops, it looks like I just sent that to one person. I'm dropping another website that is called Plantrition Project, and they have a bunch of great recipes about a whole food plant-based diet, and they have a quick start guide, which is really helpful. All right, let's go. I think we are running at the end. How much folic acid should be consumed?
So, for women, I was just trying to find an article that I had seen recently, but, again, the general is 400 micrograms a day for most people. For people at increased risk, you need to consume more. So for twins, 800. For some women who have a history of neural tube defects, some maternal fetal medicine docs will recommend 4 to 5 milligrams a day as necessary to reduce the risk of conditions for people specifically at risk. But the basic is, again, just that lower baseline amount that is really almost in every prenatal vitamin or multivitamin.
I've heard a lot of PCOS gurus say sugar is bad. What do you have to say about sugar and sweets?
So I think, sugar is prevalent in our society. And so if you look at, there's a lot of hidden sugars in foods on labels if you're eating processed foods or canned goods or jars. And, it can be in a baked good when you don't think it is. So there's a lot of hidden sugars. So I think, yes, you generally don't want to eat all that extra sugar, but when you're cooking, if you are cooking and you're cooking with a little bit of natural sugar, if you need that in place, 1 teaspoon of sugar has 16 calories. So a little, maple syrup or honey, the
Dates.
date sugar that we cook with. Yeah, some natural sweeteners that we cook with. If you want something to have a little sweetness, it's a general palatable thing that makes food taste better at times when we want to enhance some flavors. So I think a little bit when you're cooking goes a long way, and you can control it when you're cooking as opposed to when you're buying boxed or bagged or other items when you're probably going to get way more than you want.
Absolutely. Do you recommend avoiding oils since they may have a negative impact on blood vessels and promote heart disease, or are there certain oils you recommend for PCOS women over others? I know you probably have your own opinion. I actually am. I support limiting oils as much as possible because of the saturated fat and they're high in calories. So if you can go with cooking without oils, I have found that like a little bit of vegetable stock while you're cooking to keep things from sticking is really helpful. Angela, you might have more information on the studies regarding oils.
Well, yeah, I mean, when you look at people who have had cardiovascular events, then they went straight vegan with no oil, they actually were able to reduce and open up their vessels, reduce plaque, and really become disease free. So I think if you were strictly speaking and saying, a vegan using water or vegetable broth would be absolutely the best way to eat, but I think for most people that's a little restrictive. And so we generally recommend, things like extra virgin olive oil, cold pressed or expeller pressed. Some people look at things like an avocado oil or a canola oil if you don't want the added flavor. Sometimes I'll use a little toasted sesame oil if I'm going for some Asian flavored dishes and I want that flavor added. So I think, yeah, I do cook with oils and I just use them instead of say butter or something else. I think they would be a move in the right direction to go from oils, but then eventually, yeah, potentially reducing oil consumption as well would be good.
I have found that Forks Over Knives, Engine 2, and How Not to Diet are great whole food cookbooks and resources. Absolutely. I am a big nerd when it comes to How Not to Die. I met Michael Greger once and I love all of his books and his cookbooks and everything. He's a wonderful speaker, so absolutely. He also has a wonderful website for more information. He does have a couple videos on PCOS, but it's a lot of more like general overall wellness. And he does a lot of review of the nutritional resources out there, or research out there, and it's nutritionfacts.org.
Yes, I like that website as well. That's a good one.
Yeah. Can you talk about thin PCOS? It's not all about weight. Some people can have insulin resistant issues without seeing the weight gain. How can we know if our diet is working well for us in terms of PCOS if we aren't seeing weight gain? Good question.
Well, so for anybody, again, yes, thin, or, whatever your weight, it kind of doesn't matter. These recommendations are generalizable for everybody, right? Because we talked about them being good for long-term health and reducing risk of other types of diseases. And so, of course, somebody who is a lean PCOS, a patient with PCOS who is lean body weight would be able to follow this. I think one of the things you want to be concerned about is making sure, again, you have adequate caloric nutrition to adequate energy intake to meet your needs. So to have a stable body weight, to not be tired during the day, to get, enjoy the day and do what you want to do. So, and if you're trying to support pregnancy, we do worry about if somebody has a BMI that is too low. So, in that case, we usually do have our patients talk to dietitians who then could maybe help them gain a little weight, which can help their ovulatory status if they're kind of chronically BMI under 18.5, something like that. Then we do want to actually potentially have them increase their weight before trying to conceive. But in general, the recommendations are the same. Just make sure you get enough calories for your body.
The next, there's some questions about supplements and myoinositols, so we can do a quick review over that. I believe they might be talking about supplements a little bit more in a future, because it's in the next coming.
So yeah, I mean, supplements can obviously be a huge discussion.
Mhm.
The myo-inositol, when that was reviewed with the large international group in 20 and published in 2018, they found that there wasn't enough data really available in well-designed studies to support it. But I can tell you that we do frequently use it, have women take the inositols as a supplement to help with insulin resistance. And we've had women who've taken inositols have improved ovulation. So I think it can be a good supplement to use. Most of the studies are regarding pregnancy are out of Italy and they're small. But yeah, we do frequently, have somebody test something like their glucose tolerance or their tendency toward diabetes with something like a hemoglobin A1C or a 2-hour glucose tolerance test. And then if they're leaning toward having more, insulin resistance, then we might recommend that in addition to the healthy diet and, daily movement.
All right, well, I think that is the end of our time. We had so many great questions. Coming up, we have 2 or 3 more sessions. So tune in for those. The next one is on exercise and other lifestyle factors. So we'd love to see you and go from there. Now, Sarah, can you shoot me a message? Do we have any way for them to send us questions or anything like that? Yes. So the phone number here, you can call to schedule a new patient visit or get any other questions answered. Okay, well, it's lovely to see everyone.
Thank you, everybody, and thanks for the great questions today.